Yes, yes. Yes, sir. As you said correctly, Udup sir has really graced this occasion by his presence. And here I request Dr. Udupa sir to kindly say a few words regarding the particular topic and scenario. Dr. Udupa sir.
Sir, you need to unmute yourself, Udupa sir.
I think, yeah. So
Yes,
now
sir.
you are able to hear me?
Yes,
Yes, sir.
yes.
Yes.
Yeah. So I welcome all the participants and delegates, particularly today's two speakers, Dr. Anant and Dr. Shilpa, and all people, the resource persons. The very important one is an overview of COVID-19 pandemic, and the other one is about the adolescent care at this juncture. And first of all, I congratulate Dr. Somani for taking lead and organizing this particular event. And as our president, Dr. Nagappa Nayak, the founder president, Dr. Nagappa Nayak, and all the other office bearers, they are very much interested because this COVID pandemic, the physical meeting is not possible. So several webinars and several important topics, healthcare, and particularly related to clinical community healthcare issues, because we, the pharmacists, are the custodians of the medicines, and in the healthcare team, we play a very important role for distribution, and even the pandemic time, we door to door as a barefoot pharmacist, we served, and we have given a lot of service, community service for healthcare and all. We have helped for the disease management and all. So we are, though a lot of challenges are faced, but we are happy to see that pharma industry is in spite of this, we are booming. And so on this occasion, these lectures are very relevant, and I congratulate and I welcome the speakers, and and also welcome all the participants, and our best wishes from the headquarters to all the participants and the speakers. Thank you. Thank you.
Thank you, sir, for your kind words. Thank you, Somani sir, also for your welcome address. Now we will start with our first session on COVID-19 and overview by Dr. Anant Suryavanshi. To introduce Dr. Anant has completed his graduation and post-graduation in general medicine from Government Medical College, Aurangabad in 1999. Then subsequently he worked as assistant, associate and honorary professor of medicine at Government Medical College, Nanded. Currently, he is serving as faculty for basic and advanced cardiac life support course at Symbiosis Health University, Pune. And presently, he is director of Phoenix Multi-Speciality Hospital at Nanded. Now, apart from his professional services, he is actively involved in various social activities also, and he has delivered many awareness lectures for general practitioners in and around Nanded. Apart from that, he is an active participant in various marathons and have completed full Hyderabad marathon recently. So here I welcome Dr. Anant to guide us about COVID-19, the causes, the treatment, the symptoms, and adjustment. Welcome, sir.
Thank you, madam. First of all, I want to thank Western Regional Center Association for Community Pharmacists of India, that is WRC-ACPI, and especially Dr. Uddupa sir, Somani sir, and Bhilegaukar madam for giving me this opportunity to have a lecture on this topic. Actually, COVID-19, as we know, we have faced this epidemic since we are facing it since last 2.5 years. Every aspect can be discussed in gross for many days even, but I'm just taking an overview of the epidemic, how it started, how it progressed, and what are the present scenarios. To start with, actually, if we go back and see, there are epidemics or pandemics almost every 100 years. In 1720, there was a pandemic of bubonic plague in France, Marseille, claiming around 1 lakh people. In 1820, there was a cholera pandemic in Asia region, including the countries like Indonesia, Thailand, Philippines, claiming more than 1 lakh people. Again, in 1918, there was a Spanish flu influenza epidemic, infecting about 500,000 population across the globe and killing more than 100 people, more than 100 million people. Subsequently, immediately around 100 years after, in 2019, we are facing this pandemic of COVID-19. Up till now, how much is the gravity of this COVID-19? If you look at the figures, you will see that in world, these are actual today's figures, around 41.07 crore population has been affected all over the world, and out of which around 58.29 lakh deaths are recorded. If we talk in terms of India, statistics in India, so we have got official positivity of around 4.26 crore population, out of which we have lost 5.08 lakh people till death. So this is around 10% of total death scores as compared to the world in the incident as well as in the death category. Because the population of the India is quite high. What is the association of viruses and human infections? How many viruses are there? If you go in the details, we'll find that an estimate of around 10 nonillion viruses, individual viruses, they exist on our planet. What is 1 nanillion? It is around 10 to the power of 31. So these are almost enough to assign for every star in universe around 100 million times. So we live in the world of viruses, but only few of them can infect us. And the viruses decide the host and the cells to infect and multiply using its genetic material. It has less to do with body's resistance. When viruses found in the animals invade the human beings, or zoonotic diseases when they come to humans through intermediate host and manifest the disease, it's called as spillover phenomena. So what is this coronavirus? The coronavirus is known to us since years together. It has caused influenza pandemic. It's known in the history. They are medium-sized viruses, enveloped viruses, and if you look at the structure, they have got spikes over the outer border, and that's what it gives the impression of corona, also flower. Almost everyone gets a coronavirus infection once in their lifetime. This was said to be benign till we came across the SARS and MERS around 10-15 years earlier. So everyone was getting the infection, and the infection was in the form of hardly running nose, fever, cough, or sore throat. And it was very difficult to differentiate it from the rhinovirus infection. We call it rhinitis. But after the emergence of the new structure of coronavirus, we call it a novel coronavirus, it gave rise to SARS and MERS. It's a severe acute respiratory syndrome and Middle East respiratory syndrome. In the years of 2002 to 2003, SARS, the mortality in the SARS was more than 50% in say more than 60 years group. The case fatality rate was more than 10%. If the MERS, which was seen in the Saudi Arabia and Jeddah, the case fatality rate was even high. It was about 35%. But the mortality was not more than 1,000 people in these outbreaks. These were outbreaks rather. But in 2019, we came across this SARS-CoV-2, which is a basic virus we claim for COVID-19, and which spread very fast in the healthcare workers by aerolization during the procedures, and as it spreads from one person to another. This is basically the structure how the patients are infected. We get the infection through the nasal epithelium or oral cavity. The virus goes down in the lungs, and the basic spike proteins, they attach to the ACE enzyme on our cells and gets the entry in the cells. Once it gets the entry in the cells, it takes over the cell and uses its genetic material for its propagation, multiplies, and again ready to infect other cells. So this is said to be the new pathology done by SARS-CoV-2, which we found in December 2019. The mode of spread, as I discussed earlier, it's a basically droplet infection when one person directly cough in front of others, or it's a short-range airborne route transmitted through the aerosols. It can even spread by long range by aerosols. there is a gross seasonality found in the coronavirus, and the seasonality is very high. Some CO2 are seasonally in northern hemisphere, where MERS is not. The high disease burden and outbreaks occur seasonally, especially in the spring season. The incidence is said to be more. Another striking point about the COVID or corona is again the mutations in the L and S type. There are a lot of mutations we will come across in next few slides. These are the different variants we have identified till date, which has caused pathology in the human beings. First, it was alpha, then beta, gamma. The delta were major culprit in the second deadly wave of the COVID-19. And the third one was the Omicron, what we are still facing, which is on the decline now. And in the waiting list are again the lambda and mu. The symptoms of the disease, as we have seen earlier, the simple COVID infection, corona infection was upper respiratory infection, and it presented with the fever, fatigue, malaise, a dry cough. The less common symptoms were cough with the sputum, myalgia, headache, sore throat, nausea, vomiting. In the second week, the patient develops severe dyspnea due to viral pneumonia. So this is novel thing. In the subsequent weeks, patient ultimately needs ICU with up to half needing the intubation. So if the 100 people are infected, around 80% of the people, they get mild symptoms, but 20% of them got severe infection. Out of those 20, 5% needed the ICU, intubation. They went in the cytokine storm and multi-organ failure, ARDS. Even other systems of the body, apart from the respiratory affected, were heart in the form of cardiomyopathy and myocarditis. Patient went in cardiogenic shock. Even the thrombosis and thromboembolism phenomena were almost known in those days, and that was a major cause of death in postmortem. In few cases, postmortem was done, and this was the reason. So the comorbidities and the risk conditions. COVID affected many people, but very few of them succumbed to death, and most of them survived. And one of the major reasons was presence and absence of comorbidities. And those were in the form of obesity, elderly age, long-standing hypertension, uncontrolled diabetes or diabetes. So COVID, coronary artery disease, hepatitis B, cerebrovascular diseases, evidence of chronic obstructive pulmonary disease, bronchitis, COPD, asthma, presence and absence of cancer, evidence of CKD, and these were the comorbidities. The children are surprisingly spared, and the reasons found for sparing of the children was the amount of ACE2 enzyme was less expressed in the oral cavity and the bronchi of these children, and there is a strong innate immunity which is favor the children's. And third was there was absence of comorbidities in the children. How these cases were diagnosed? So most of the diagnosis was on the symptoms, but there was detection of antibodies in rapid test. It was done. Then RT-PCR was basically the ideal test, so said to be gold standard those days. In few patients, HRCT of the chest was done, and that was showing the GGOs, ground glass opacities involving the lung fields. The other investigations needed for treatment and progress included the COVID profile, and that included the enzymes for damage of lungs. The testing again in progress, antigen detection, rapid test takes around 30 minutes and viral proteins are detected. The sensitivity is said to be hardly 30 to 40% less than RT-PCR. RT-PCR was a gold standard. It detects the RNA or the fragments of RNA. The samples from the nasal and oropharyngeal swabs were taken. The sputum was again said to be better, but the collection process was tedious and it was more infective. So that's why nasal and oropharyngeal swabs were preferred. Specificity of around 95 to 99%, but sensitivity was 60 to 80%. And that's why in few patients, the first test was negative, but the symptoms were persistent. So second test done, it came to be positive. How these cases were treated? So as we saw, most of the cases having mild and moderate symptoms, they just required isolation and symptomatic management in the form of paracetamol, cold and cough medicines. We avoided ACE inhibitors, and the family member support was needed. isolated the patient for 1 to 2 weeks in mild cases. The moderate cases having the risk or severe or critical symptoms, which was around 15 to 20%. The inpatient management and supporting care continued. Few patients required oxygen either by nasal cannula or face mask. Then the patients, especially those deteriorating and requiring BiPAP or non-invasive ventilation was done. Those who landed in ARDS needed intubation, endotracheal intubation, but the recovery of patient once the patient was on ventilator was very less. So this route was the final mode of treatment. ARDS took time for resolving, and as I told earlier, we had to monitor the renal and other parameters, including D-dimer levels for management of such patient. In severe risk cases, BiPAP was used. Patient do worse on BiPAP compared to the high flow nasal cannula. So this was again one of the invention which used in these cases frequently all over the world. The sickest group was given dexamethasone or steroids plus tocilizumab within 24 hours. Actually, how COVID infects body and how it causes the damage of the host. First is the viremia, and second is the body's immune response against those viruses. So those who had a strong immune response, they landed in a cytokine storm, and that's why those patients were very hard to manage and difficult to come out. The drugs which tried were the chloroquine, hydroxychloroquine, ivermectin, ritonavir, lopinavir, ribavirins, interferons. There's a list, but actually we got approvals about the remdesivir, just like remdesivir. Then IG, serum antibodies of recovered patients was also given, tried in a few patients, and it was called convalescent plasma therapy. Nowadays, even monoclonal antibodies are also available. We gave high dose steroids for few patients, but that was a reason, that was a culprit behind these mucormycosis cases, which were very tremendously seen in the history of infections, fungal infections. The specific treatment which was given was antivirals in the form of remdesivir. Remdesivir was said to reduce the viral load. Second category was immunomodulators, which dampen the immune response, what we saw in such cases of cytokine storm, and they were dexamethasone, tocilizumab, and bacitinib. Third was antibody cocktail, which are the monoclonal antibodies. These are man-made antibodies inhibiting the coronavirus from infecting new cells, so lowering the risk of death in severe COVID cases. And these were keesrevimab and imdenivimab. About this modern pandemic, as we talk more and more about the things or subjects, we know less. Similarly, there was a flooding of information since the COVID infection started. People were quarantined at home. There was a state and district quarantines, right, from 10 to 14 days. But the lockdown continued for almost 3 to 4 months, 6 months. There was a nationwide lockdown to stop the movement of population. There were frequent changes in the guidelines given by ICMR, WHO, or reputed journals, even like Lancet, and this added to the chaos during this pandemic. Hundreds of the papers were published, adding to the confusion about the management of COVID-19. The drugs were taken, drugs were withdrawn, and attempts started on the war front for development of vaccine. The vaccines were successfully developed by Bharat Biotech. It was called as Covaxin. It's a mRNA vaccine which uses inactivated or weaker viruses to generate immunity. Another vaccine developed by Serum Institute of India was Covishield, which used genetic engineered virus to carry the DNA. And this DNA instructs the cells to produce the proteins which generate immunity against COVID virus. So this is the vaccination done, the chart done, vaccination is done till date. We find that fully vaccinated population is around 54.71%. 71.3% people have received first dose, and total doses administered in India are almost 1.7 billions. So we are on very high front alert for the vaccination drive all over India. So this is the map which shows from 20% to almost 70% plus vaccinations done all over India till date. So you'll find that there are patches, light patches in the eastern part, but most of the area is orange. That's in the around 50 to 60%. So as we know, there were almost 3 waves. The first wave started in May 2020 to October 2020. As the madam has already explained in the introduction, it was in those period actually we had very less resources, less information, and very less gadgets to tackle the epidemic. So it was, fear was too much high during this period. The second wave started in the April 21 to June 21, and it was especially by the Delta variant, but the mortality was almost 40% than the first wave. The third wave, which it was actually still going on, but now it started from December 21 to till date, but the mortality is very less, and especially this Omicron variant is said to infect only the upper respiratory tract, and almost hardly we have seen any patient which is coming with the GGOs on CT scan and requiring BiPAP oxygen or ventilation. So those comorbid patients who already were going to die, in those cases, this was an added infection where we are getting these cases of death in Omicron. Otherwise, directly speaking, there is not a single mortality because of Omicron in a healthy adult. This is the comparison of first and second wave of COVID-19. We have seen the causative agent. The second wave was because of the mutation of the first variant. The knowledge of the disease in the first wave was less. We got a lot of knowledge in second wave. The symptomatology was limited to respiratory cases in the first wave, but even it involved GIT and cardiovascular system. And most cases of ARDS were seen in the second wave. The presentation, though it was severe in SARS-CoV-2, the mortality was in the first wave mortality was less. The presentation in the second case were less intense compared to first. The shortness of breath cases, breathlessness cases were less in the first wave, more in the second. In the first wave, we find elderly people were affected. In the second wave, younger people were more compared to the elderly one. We were prepared with oxygen in second wave, but it was not so during the first wave. Even the vaccine was available for our help in the second wave, which was not there for first wave. About the Omicron, I think this wave has already gone down. There was steep rise of cases from November 21, and it has taken the place of Delta. As I told you earlier, it affects the upper respiratory tract, and the cases of consolidation or pneumonitis, ARDS were very few, almost nil in this category. And our innate immunity, what we have, and the vaccination has done its job to curtail this Omicron variant. So there's no point in talking about it. In vaccination Omicron, the vaccination what we have received, the Omicron is not immune against vaccination. So many people who were already vaccinated in the first and second wave got this Omicron infection, but the progress was not so deadly. We are getting few cases of long COVID. So patients who had COVID-19 in the past, they continued to experience mild symptoms even after 6 to 8 weeks after their initial recovery, even in the young patients. So this was something which was a bit astonishing or surprising, because earlier epidemics were there, but they were not followed by after effects of the epidemic. In these COVID cases, we are getting a lot of cases. They come with the fatigue, breathlessness, cough, joint pain, chest pain, cognitive problems, even depression or schizophrenia-like symptoms, headache, muscle pain, memory problems, loss of smell, dizziness, etc. What is the reason for this long COVID? There are two possibilities. First is, during the infection, the virus goes at multiple places in the body and have its effects, direct effects. The second hypothesis put forward is innate immune response after this infection of the own body. So if you remember about the chikungunya fever, that was again a viral infection, and we got same after effects for even 1 to 2 years, 3 years after this chikungunya epidemic was gone. So The blood clots and blood vessel problems are also seen in some patients, and they presented with the heart attack and strokes. The incidence of heart attack strokes increased in those cases who had COVID earlier. The problems with the mood and fatigue was also seen. But a lot of things to be again learned about this long COVID. Large medical centers are even opening the specialized centers for such patients to deal with COVID-19, long COVID. So what lessons we have learned? So there is the role of media in creating the panic. The panic which was made was really horrible those days. We saw almost daily hundreds of breaking news on different channels. Use of restrictions or sudden lockdowns made the sufferings of the people worst. The shortages and black marketing of drugs, oxygens, and essential instruments like ventilators was seen very markedly in this period. And so we have to be prepared for the future. Different countries have different, they should have different strategies rather than uniformity, because the conditions in the US, they are different from conditions in India. So there has to be a bit different change in the protocols, what is directly blindly followed in the US and in the countries like India or African countries. Our primary health care facilities, they are not yet focused. So every patient who had a breathlessness, they directly came from village to the district place. There is no in-between intermediate hospital to take care of such patients. The number of ICU beds was seen to be very meager those days, and this had to be increased. And finally, more budgetary provisions for the health should be there, so that more and more centers will be prepared, well equipped to take care of such patients, and more graduates will come out to face such epidemics, pandemics. What modernization has done with COVID? The first patient of COVID was diagnosed in the city of Wuhan in China in December 19, but it spread to 212 countries across the world, infecting millions of the peoples within 3 months. So this was because of the transportation in the modernization. Earlier, if you go back and see the epidemic of 1918 or 1920 about the Spanish flu, we'll find that it took 6 months, years together to spread from one continent to other. But now, because of modern transportation, we had a very fast spread of this disease. We had a progress in the field of modern science, medicines, technology, transport, but it was not enough to stop the spread of disease and mortality during this pandemic. Raising oxygen demands, ICU and ventilator bed equipments were not met even in the countries like Italy, who spent most in the world on the health. So how to manage the future epidemics? So first of all, it's basically the prevention, and prevention parts involves number one, vaccines. So use of vaccine should be there. So healthcare workers, now they are given the boosters. They should complete the 2 doses, take again the boosters who come across the sick patients in the wards or ICUs. Washing the hands, personal hygiene, sanitation, infection prevention measures should be there. Surveillance of the cases should be there. We should go on doing more and more cases, so that those who have got the disease, who have got the morbidities, comorbidities, they should be timely isolated and sent to the tertiary center. There has to be containment or isolation of risk persons. Contact tracing should be there. Quarantine based on the exposed person should be there. The non-pharmacological measures include personal, again, hand hygiene, covering the cough, staying away from the sick persons, avoiding direct touch of contact from the table or anything you touch, like doorknobs to the mouth or nose. Social distancing should be practiced wherever there are social gatherings. Mass gatherings should be cancelled. Non-essential activities should be cancelled. And environmental cleaning is again a good, it has got a good measure against for prevention of the infections like COVID-19. What is the fate of COVID-19? Crisis to control. So once upon it was a crisis, now we are in a stage of control. So we talk about the pandemicity of the COVID-19, but now it is going to be endemic in most of the areas. So we'll come across many such cases for months to come in future, or maybe years to come in the future. So it's our lifestyle, vaccination, and our approach towards the disease will decide the new normal approach for this COVID-19. We have seen thousands of deaths to present situation, which is under control. It is less likely that we will come across the condition, we'll have the conditions as we thought before December 2019, before the virus was not there. We will not have those conditions. We will definitely get the cases. So viral infectious diseases cannot be eradicated. So there are two major points why those cannot be eradicated. So when there is a limited long-term immunity following the infection or immunization. So whatever we have immunized, we got the immunization. So it is useful for few days, maybe 120 days, in cases 180 days, but not more than that. So yearly immunization may be a fact in the coming future. Second thing is these viruses, they have got non-human reservoirs. So that's why even if you have your measures for control of the disease in the human beings, you cannot rule out, neglect or this non-human reservoirs. So COVID-19 would be there in like spikes of cases in between due to the different mutations. The symptoms will range from simple flu, as we come across in the Omicron category, to the full-blown COVID as per the immunization status and comorbidity level of the individual population. What remains with us? So we should continue the universal measures, use of N95 or K95 mask at public places, good hand hygiene, then social distancing, avoiding crowded places. As I said earlier, yearly immunization may be a reality. There is still research going on about the universal vaccine, which is said to be effective against all the different strains in the futures to come, but it is still in the progress pipeline. So learn from the past lessons. Government should change its strategies accordingly. Individual precautions are again important. The test should be widely made available so that those infected could treat and isolate timely. Improve the air quality indoors by use of HEPA filters in the schools, classrooms, gathering halls, marriage halls, like that. The use of HEPA filters in big halls should be a reality. And again, the major important factor which we can control at least is control of risk factors. So proper and timely treatment of hypertension, diabetes mellitus, heart, kidney, and liver disease, mental health support centers, counselors for the emotional stress situations, avoiding addictions, sound sleep, daily exercise, healthy diet, and having a good and healthy weight. So I'm ending my presentation with a simple message of choosing the good food, avoiding the fast food, pizza and burger, including the Maggie and what we see on the advertisement. There is no advertisement of puri, chapati, bhaji on television because people don't earn out of that, but that is said to be the most healthy homemade things. Then go for the aerobic exercises and weightlifting, irrespective of your age. Take a opinion of physical instructors, and according to yours, you can modify the exercise. Then 7 to 8 hours of sound sleep should be a reality, irrespective of your schedule and working. Staying away from the stress. So keeping or spending time with your friends and beloved members, with your family. Then again, doing the things that make you happy. So this stress is again a big killer. I think this much is enough. So it was a big marathon discussion about the COVID-19 overview. Thank you, madam, again.
Thank you, sir. It was really a wonderful session. I should say it was very informative within a stipulated time frame of 2 sessions. And most of the things actually are been covered in the slides. There were few questions what I had drafted, but I got the answers when you were going through the slides. Now, apart from it, if any of the participants want to ask something, you can drop in the questions in the chat box. Participants, if there are any doubts.
Dr. Udupa, so as I
Yes,
raise this, because even I have given talk on this several platforms, and also I'm happy to inform you that from Manipal University we are the first, because I am the chief editor of that COVID pandemic multiple dimension book. So this was brought out a 1,000-page book. 500 copies are already sold, and it is available. Manipal University has published it, and it is a 60 authors, including some foreign authors, and also a lot of research was done, and included even on the Ayurveda chapter, immunity, like yoga and all you mentioned, exercise and all these things, prevention, precautions, all these things are given, and it is about 30 chapters, 60 authors, and as I have told, it is a 2,500 rupees book, which is available, just 1,000 rupees, 50% concession is available. You can always contact. It is available by Manipal University Press and other. Actually, this British journal, they have also taken up the distribution and elsewhere and all. They are popularizing. And you have covered all the aspects. So again, giving stress on prevention and sanitation, environmental aspects, protection, wearing a mask, all these things. And exercise. Actually, very simple thing is walking daily. The walk, of course, so environment itself, even inside and house and all, within the campus or within the colony, with the mask and walking, and also the simple yoga exercise, particularly pranayama and all. All these things will give a lot of immunity. Yeah, and also vitamin C and all, you are told. Of course, medicine and treating diabetes, hypertension, and all this. So regularly seeing the physicians and all, handling of the comorbidity and all this. So very good. So I congratulate, compliment the organizer and the speaker for a very good lecture. Thank you. Thank you.
Thank you, sir. Congratulations for the book. Actually, Manipal always comes out with a good collection of edited books. We are happy
We
to.
have sent to all the main medical dental libraries. It is their
Yes, yes.
compliment copies were sent,
Yes, sir.
and you can contact Dr. Rakesh Somani also knows.
Yes, sir.
Thank you.
Sir, over here, actually, there are few questions in the chat box. So over here, there is a question that whether the treatment is same for all the mutated forms.
Yes, ma'am. The treatment is basically, in viral illnesses, we don't treat virus itself, we treat the symptoms. So it's a symptomatic treatment.
Yes.
So
And
any mutation, the treatment is same. And going across antiviral, officially remdesivir is already been in market since long. It is US FDA approved. Nowadays, even monoclonal antibodies are again useful. These monoclonal antibodies were not useful in case of Omicron, rather. The reasons being different. Omicron is one lecture actually.
There is one more question, that what is the difference between L and S type of mutation? I and S or L and S, they have asked.
So actually, these are on the outer capsid of the coronavirus, L and S type of receptors. And there are mutation or changes in these two. So this is basically responsible for attachment with the host cells. So it's a part of mutation.
Sir, what about Neoco that is coming into picture now?
It is being discussed, but actually, the whatever studies have come across, they are not on the human beings. It is said that it is 10 times deadlier than COVID-19.
Yeah, that's in between. Like there was a lot of fear.
Different virologists have already of the opinion that this wave will not affect human beings. That is a theoretical risk or theoretical fear.
Then, sir, during your webinar, you had even talked about there are some non-human reservoirs.
Right.
Okay, so what exactly you mean? Are these related to the physical reservoirs, or it is animal reservoirs?
Animal reservoirs. As we have seen, the Wuhan, in the virology lab of Wuhan, it was especially discovered from the bats.
Okay.
So some animal market was there. And the infection was thought to be spread from this bats. So bats could be one reservoir. Another, again, few reptiles. We can see this COVID virus, coronavirus, the reptiles. like mammalian.
Okay. Then, sir, there was difference in the days of quarantine. Like, there were something in between, like, that whether really the COVID is existing because, or it is just like, something which is inflated. Then few were saying that testings are not there, results are not correct. Then the quarantine period was varying. Initially, it was around 14, then 10, then 7, in between 7, then 10, again 7. So why then, like, miss, how come the quarantine period can be varied if the infection is
Actually, everybody was behind this information. Lot of studies were going on in different part of the country or world. But once you get the symptoms, after getting the symptoms, the patient has to be isolated for maximum 5 to 7 days, not more than that. So after that, the infectivity is lost. The patient is no more infective to others once the patient gets the symptoms. Once the patient's symptoms are resolved, it is maximum 5 to 7 days, not more than that.
Okay, and one more thing is there, the question that is normally, like, as you said, developing the proper immune system is something which is important for everyone, because as it is a endemic now, we can say. So over here now, many people, like, they were behind taking the daily doses of the vitamins and zincs. How safe it is, sir?
Already, if you talk in terms of the Indian diet, that is enough. We may not require additional doses unless patient is having some associated diseases. So in terms of diet, if we are taking regular vegetables, fruits, non-vegetarian foods, sprouts in your diet, there is no need of taking additional supplements unless they are needed. It's not for everyone.
Yes. Okay, sir. Thank you. So there are many comments are there in the chat box. People are even asking about whether booster dose is necessary.
Yes, presently booster dose has been advised only for the healthcare workers, rather, or those who are in the working, taking care of the COVID patients. For general population, it is yet to come, rather. So we can just wait.
Okay, sir. Everyone has given comment that very informative session, good session, nice information. So thank you, sir, for such informative lecture. Okay, these are all the questions which were present in the chat box.
Right. Thank you, madam.
Yes, sir. Thanks a lot.
Thank you, WRC, ACPI, office bearers, and everybody for giving me this opportunity. Thank you so much.
Yeah. Thanks a lot, sir. Now, in the meantime, I'll request Dr. Shruti.
So, good afternoon, Shilpa. I think screen share has to be stopped. Then I can.
Yes.
Yeah.
Yes, sir. Anand, sir, can you stop sharing the screen? Hello, Anand, sir. Dr. Anand. Can you stop sharing the screen, sir? Should I message him?
Yeah, just stop ma'am once. Yeah, Dr. Shruti, you can try now.
Yes. Thank you. Actually, I'm not able to share the screen. Just now. Is it visible?
Yeah, yet. You're logged in from another computer also, desktop?
No, same. Just a minute.
Your screen is visible.
Screen is visible?
Yeah.
Okay.
Yeah, the slides are too.
Yes, everyone. So we are here for our second session, and we are having with us Dr. Shruti Kalkekar, who will be speaking on child and adolescent care in COVID times, which is a very important topic with respect to handling the kids, especially whenever they are having everything which is online as scheduled. So over here now to introduce Dr. Shruti. Dr. Shruti Kalkekar is a pediatrician, leading consultant in pediatrics based in Navi Mumbai. She is known for her comprehensive and tender approach towards her patient. She did her graduation at MGM's Medical College, Aurangabad, and pursued post-graduation training at Terna Medical College, Nerul. She's worked in various neonatal intensive care units to enrich her experience in neonatal care. And right now she's associated and she's director of Kalkekar's Cura clinic. Over here now, as I said, that she's actively involved in community health programs, and she's a committee member of adverse events in immunizations. Then she's chairperson of ethics committee of Asha Multispecialty Hospital, Kamote. Now, apart from this, she has also undertaken a postgraduate program in pediatric nutrition at Boston University in 2018. And currently, she's pursuing her postgraduate diploma in adolescent pediatrics at Kerala University. She's actively involved in various social activities, and apart from that, she's fond of various extracurricular activities also, such as reading, singing, and poetry, followed by sports. So we welcome here Dr. Shruti as our speaker for today's second session of this webinar. Dr. Shruti, you can take over.
Thank you very much, Dr. Shilpa, for your kind words. Very good afternoon to one and all. Dr. Suryavanshi made my job very easy by giving brief information on COVID. Thank you very much. And first of all, I would like to say thank you to the Somani sir, Udupa sir, and the entire Western Regional Center of Association of Community Pharmacists of India for inviting me as a guest speaker. I'm deeply honored. I'm also thankful to Dr. Shilpa for coordinating about the session. I'm also grateful to our IAP President, Dr. Jitendra Gawane sir, Secretary Dr. Satish Sahane sir, and Dr. Mangai for their constant support. So first of all, today, I must appreciate and acknowledge the work done by entire community pharmacists who are relentlessly working since last 2 years in this critical COVID time. In true sense, you all are COVID warrior. In today's session, I will try to cover all important aspects in terms of child care in COVID times. So in today's session, what we are going to discuss, how to keep safe to your children during this COVID time by ensuring the hygienic practices, by preventing the infection through vaccination, to boosting up the immunity through nutrition, at the same time, getting to know about the psychological health, being alert about the red flags so that we can timely manage the patients. So I'm not going in detail with the COVID infection, but I would like to tell you about how COVID present in the children and how to find out about this COVID infection on time so that we can manage them well. So SARS-CoV-2 in children can present in 2 ways. First of all, there is a acute COVID illness which comes in mild, moderate, and severe, in which 90% have a very mild course with quick and complete recovery within a week, but can be followed by complications like COVID pneumonia, like in adults, but incidences are very less. There is one more serious infection, what we call as multisystem inflammatory syndrome in children as well as the neonate. It can occur few weeks to few months after COVID illness, which could have been mild enough to be unnoticed. Can be seen in neonates to born to COVID positive mothers in third trimester or during delivery. Now let us see the burden of pediatric and adolescent cases in India. So this graph you can see is the age distribution is shown, in which total confirmed cases in India is 3.95 crores. And in this, the cases below age of 20 is 12%. So what we need to understand, the cases are not that much, but yes, we need to take care of them. So pediatric COVID-19 is majorly comes as a mild or asymptomatic, in which 90 to 95% cases are taken care at home, in which daily follow-up by teleconsultation in fever clinic can be done. The 5% are moderate cases, which can be managed in the pediatric COVID care hospital, and only 1 to 2% are in the severe pneumonia, which require high level of treatment in COVID care. Now, today I'm going to discuss two cases in which I will let you know about the mild, moderate, and severe infection and the MISC. So to start with the case one, Seema is a 13-month girl child who is having fever since 2 days. There is no cough, cold, or vomiting. Otherwise, she is clinically normal. Father is under home isolation since 5 days because he is detected COVID positive. Mother is asymptomatic, but she is not tested, and she is breastfeeding Seema. Other members are like older brother, father, and 65-year-old grandmother in a room apartment with a common toilet. So now parents are very much stressed out, like if now this is a fever, and as this is a COVID pandemic going on, so is it COVID? And if it is COVID, then what to do? Whether it will affect my child? So there are a lot of questions. So let us see first what are the symptoms in children. COVID-19 is a bit different in children. It presents in a different way. So all ages, children of all ages can become ill with COVID-19. However, most kids who are infected typically don't become as ill as adults. And some might not show any symptoms at all. That is, they remain asymptomatic. The children rarely experiences severe illness with COVID-19, and the symptoms tend to be mild and cold-like. Most children recover within 1 to 2 weeks. The symptoms are like fever, runny nose, cough, body pain, vomiting, and diarrhea. In the adolescents, adolescents is the age group of 10 to 18 years of age. So in this, they experience the same symptoms like an adult, and they are also mild, cold-like. But adolescents are, they can get severe disease, but death and severe cases can still happen in adolescents. Their symptoms are same like adult, like very high grade fever, runny nose, sore throat, cough, fatigue, then muscle pain. Now, if your child shows symptoms of COVID-19, and if you think that he or she might have COVID-19, so first is call your pediatrician immediately. Take your child outside only to get medical care, and that is also followed by the precautions. You can consult with your pediatrician through teleconsultation. The doctor may consider testing if your child is at higher risk of serious illness. Nowadays, a fever clinic are developed, so the doctors are ready to do the teleconsultation. Now, coming toward the case one, now how we are going to find out whether it's a COVID. Now, symptoms and signs, as I explain you, they are same like any viral illness. So how to differentiate them? Now, what you need to understand, the fever, how it starts. So fever, mostly it starts sudden, abrupt onset, but you need to check with the interfebrile period. In this interfebrile period, whether the child is active, playful, or he is dull, lethargic. Then the child may also have a headache, myalgia, fatigue, tiredness. The child may have coryza, cough, sore throat. The child may experience rapid breathing, diarrhea, vomiting, abdominal pain. So all these symptoms is present in the COVID. So how to confirm this test? How to confirm this COVID? Now, everyone knows about the RT-PCR and rapid antigen test, but is it really recommended for all suspected cases? Yes, I would say yes. Testing is recommended ideally for all suspect cases. But if resources are scarce, testing may be deferred for children with mild symptoms and no comorbidities and with a known positive contact. Now in Seema's case, there is already positive contact, like there is a one family member who is COVID positive and she don't have any comorbidity. So we can find out this way. And first of all, rapid antigen test need to be done as soon as we find out. And after that, if rapid antigen test is negative, then only RT-PCR to be done. Rest, we need to find out the family and housing details. Like as in her case, there was a common toilet. So it should be always separate the grandmother so that she is not getting the infection. Now let us see what exactly mild COVID look like. Now the mild COVID means what? So there is no any signs of lower respiratory tract infection. So that is come with a fast breathing. Now in children, what you need to consider, the respiratory rate is depend as per the age. Now this chart, you can see the chart, it is as per the age. So below 2 months, more than 60 per minute is considered as a distress. And you can find out with the abdominal breathing. Now, if there is any kind of lethargy and is there any signs of dehydration. So dehydration you can find out with the less urine output. So all this, if all the signs are not present, then it is termed as a mild COVID case and it can be confirmed by the rapid antigen test or RT-PCR. Now, if it comes positive or suspected, what are the care to be given such cases? The first of all is isolate the child and the grandmother to stay separate to avoid infections. Other family members can wear the mask and the child is shifted on the full normal diet. Extra fluids can be taken and continue the breastfeeding. Now here, many of you might be wondering how a small children can get isolated. They are not going to stay alone. Then I would say yes, it is very, very difficult to isolate a child because they want their family members, and even the sickness, they need more attention. So in that case, what precaution you need to do is the family member who is vaccinated, who is healthy, they can take care of that child, and also by following the COVID appropriate behavior. Now, the importance of extra fluid is very much in the COVID, as more and more hydration help a child to get rid of the infections. Like more and more hydration, the child is safe. The breastfeeding, this is one of the very important point what all mothers need to understand. Even you are breastfeeding, you must feed your baby to protect your child. And I'm going to cover this on the later slides, how to go ahead with that. Some older children, if they can gargle, you can go with the saltwater gargling. Then the symptomatic treatment. So what is mean by the symptomatic treatment? So in the mild cases, mostly the fever is the main symptom. And I have seen a lot of parents, when their children are sick and they are having fever, they get very much stressed out. So I would advise all those parents, once you learn how to take care of your child during fever, I'm sure you will your child will get very early with a better recovery. Now, for this fever, what you need to understand, every fever in children, the fever medication has to be given as per the weight. So as per the weight, if you are giving the medication and the fever, usually the medication to be given when the fever is more than 100 or 101. For mild fever like 99, 100, this fever can be managed on its own. No need of even fever medication for such cases. Only you need to loosen the clothes, you need to hydrate the baby, and at the same time, if the baby is okay, you can lukewarm sponge the baby. So this way you can handle the fever. Some parents, they are very much in hurry to give the another medication if the fever is not responding to the paracetamol. So in that case, what you need to understand, the fever usually take 1.5 hours to go to the normal level. So we need to wait and just keep on continuing the sponging as well as hydrating the baby so that fever will touch to the normal baseline. This is very practical thing what everyone must know. And another important thing is there should be no antibiotics is given to the children. Self-medication is better to avoid it. No any investigation is also, it is not also required. Now, these children, the mild cases has to be monitored at home by parent or Anganwadi worker. Now, in this monitoring, what you need to cover up is checking the temperature, pulse, oxygen saturation, urine output, and the fast breathing. So always maintaining the chart. So this is one example of the home monitoring chart. Now, as of now, it's in the last 2 years, everyone has learned about how to check the temperature, pulse, everything they are knowing about it. So in children, what is more important is their urine output. At least they should pass adequately throughout the day. And another is the respiratory rate. At the same time, oxygen saturation should be above 95%. And if it is any other symptoms, if you found some like vomiting, diarrhea, so you need to keep a note and inform to the fever clinic. Now, this home monitoring chart has to be filled by the parent or caretaker, and daily they can update to the fever clinic to the through the WhatsApp or the photograph to be sent, but they should be in touch with the doctors. And they should inform immediately if any of the symptom is worsening. Now, what next? Like comorbidities, as just now we have discussed about the children who are having comorbidities, they are at a risk of a moderate infection. So comorbidities like cardiovascular disease, hypertension, diabetes, the immunocompromised status, the chronic lung diseases, kidney, chronic liver disease, cerebrovascular diseases, and obesity. Yes, obesity is also one of the disease which may affect your children. Now, if your child is having mild fever, at the same time, there are no comorbidities. So you can continue as per mild disease at home. But if the child is having comorbidities and if there is ready access to the healthcare center and with a reliable attendant, you can continue as per mild disease at home. But if there is no any ready access to the healthcare, then definitely such patients need to admitted into the pediatric COVID care hospital. Now, every parents need to understand about what are the red flags. So red flags are like an alarming sign. So any persistent fever, more than 3 days, there is a reduction of urine output, the child is very dull, lethargic, drowsy, and it's having a rapid breathing, then oxygen saturation is less than 94%. If there is some kind of rash, then it's labeled as a moderate disease, and this may require admission. So this is a comprehensive guidelines for management of COVID-19 in children below 18 years. So as of now, what we learn, asymptomatic and mild cases can be isolated at home and managed through the teleconsultation by ensuring oral fluids, adequate oral fluids, as well as giving the nutritious diet. By monitoring oxygen level, also before and after 6-minute brisk walk in children more than 12 years. And the very important is antibiotics are not recommended. The moderate and severe cases are need to get admitted in the COVID-19 hospital, in which anticoagulants and steroid therapy may be initiated under strict medical supervision. Now, this is a very important slide that I want everyone to look into this, that what is the role of antibiotics in COVID? Now, COVID-19 is a viral infection and antibiotics have no role in the management of uncomplicated COVID-19 infection, especially in the children. Asymptomatic and mild cases, these cases are also, the antibiotics are not recommended for therapy and prophylaxis. I have seen many parents, they request, please give antibiotic as a prophylaxis because our child may get serious infection, but no, there is no any role in the prophylaxis. And in the moderate and severe cases, the antimicrobial should not prescribe unless there is a clinical suspicion of a superadded infection. In terms of septic shock, the empirical antimicrobials are frequently added to cover all likely pathogens based on clinical judgment, patient host factor, local epidemiology, and antimicrobial policy of the hospital. Now, the role of steroids, I would say same. that it is not indicated in the asymptomatic and mild cases. It is only indicated in the hospitalized, severe and critically ill COVID-19 cases. And it should be used at right time, right dose and for the right duration. Indication and recommended doses are used in rapidly progressive, moderate and all severe cases. So methylprednisolone, dexamethasone can be used, and taper. Anticoagulant. It is also not indicated routinely. All hospitalized children can be evaluated for the risk of developing thrombosis and monitor for development of thrombosis. This prophylactic anticoagulant is indicated in the following circumstances. So anticoagulant enoxaparin can be used till child is discharged from the hospital. Now, once the child is discharged, that is very important to take care of the children after COVID. So children with asymptomatic infection or mild disease should receive routine child care, appropriate vaccination, nutrition counseling, and psychological support on follow-up. In addition to above, for children with moderate to severe COVID at discharge from hospital, parents or caregivers should be counseled regarding monitoring for persistent and worsening respiratory difficulty and explain the indication for bringing the child back to facility. Children who develop any organ-specific dysfunction during hospital stay or subsequently should receive appropriate care. Now coming toward the second case. So the 4-year boy who's having high fever since 3 days. Mother has noticed urticarial rash, child is irritable, tachycardia, conjunctival hyperemia, mild redness of lips, and the tender liver. Father had COVID 2 months ago. So what can this be? Can it be COVID-19? Or can it be COVID-19 related to something else? So let us see. When to suspect the multi-inflammatory syndrome in children. So any child or adolescent with fever more than 3 days is having urticarial rash, bilateral non-purulent conjunctivitis, red lips, inflammation in hands, feet, BCG scar reactivation, very irritability, acute GI symptoms, diarrhea, vomiting or abdominal pain, tachycardia, tachypnea, oliguria out of proportion to the fever, and no other obvious cause of inflammation like bacterial sepsis, staphylococcal or streptococcal shock syndrome. And there is a very important is a history of COVID-19 or contact with the COVID-19 case in previous 3 months. So what is this MISC? So MIC is an multisystem inflammatory syndrome in children. It is an immunologically mediated condition which can affect multiple systems such as heart, liver, kidney, etc. And it may manifest as fever, rashes, conjunctivitis, or the redness of eyes, severe abdominal pain, or poor perfusion. So it can present in the neonate also. Now, a neonate, how it can get COVID-19 infection? So it can get COVID-19 infection in 3 potential ways. The first and the most important is the aerosol or direct contact from infected mothers or caregivers, including the healthcare workers. In the postnatal period, most likely method of transmission. The rest 2 are very rare. That is the intrapartum infection and the transplacental passage to the mother to the fetus. So all these MIC cases can be treated as per the symptoms in the hospitals. So this is the comprehensive guidelines for management of COVID-19 in children. Now, once you know the severity of infection, how it affects your children, you must follow the COVID appropriate behavior. So I'm sure everyone is knowing about this, but I give emphasis on following and practice this behavior. So watching your distance, washing your hands, wearing a mask, following the open spaces, avoiding the poorly ventilated areas. At the same time, vaccination of 15 to 18 years of age group, because this is one of the vulnerable age group which can develop the serious infection. The COVID appropriate behavior is recommended to prevent SARS-CoV-2 infections. Now, we are not going in details of how to take a precautions to COVID-19 in your children, because everyone knows about it. What I would like to give emphasis on, making your child to wash your hands. I know it is very difficult to make them wash their hands. Many parents complain that our kids don't listen to us. They are in hurry, they want to play. So I would suggest, I would give 2 tips for all the parents that For being a role model, so washing your hands regularly, frequently, the children, they watch us and they follow us. The second, the most important, is teaching them the right technique. So as long as you are teaching them in a right way with complete patience, it is very easy for us to teach them. So coming towards the next slide, wearing the face mask. Now, to prevent COVID-19, still the very important precaution is wearing the face mask. Now, there are a lot of myth and a lot of misunderstanding in using the face mask. So I will clear it later. All children has to wear the face mask, especially in the crowded area, to avoid the close contact with others. Now, in case of teen, it is difficult that usually the teenagers are rebellion, so they don't listen, but make sure you keep patience and tell them and advise them to wear the mask. So if they're going out for any core exercise, just tell them to wear a cloth face mask. If they have any kind of breathing difficulty, avoid using the face mask, and ask your child to avoid people who are sick, coughing, sneezing when they are out in the community. Now, this is a very important slide. What I want all of you to look into this. So guide for using mask. Usually below 5 years, the masks are not recommended. It is not the case that they are not getting infected, but yes, the chances of hypoxia can be more, because these children are not trained proper. These children cannot be trained for the using the mask, so they cannot handle it, and it is better to avoid below 5 years. Children from the age of 6 to 11 years can wear mask depending on the ability of child to use mask safely and appropriately under direct supervision of parents and guardians. Children above 12 years and over should wear a mask under the same condition as adults, and ensure hands are kept clean with soap and water and alcohol-based hand rub while handling mask. Now, cleaning and disinfecting home. Yes, when you are going out and you're coming back to the home, hand washing is the priority. At the same time, if there is any infected person in family, so always the areas has to be clean on a day-to-day basis. So common areas which are frequently touched, they can be clean. Also, the surfaces where the children are often touching, that can be wiped. Wash children clothes when they come from outside, and also ask your teenagers to help out in this cleaning and disinfecting activity. And through this, we are teaching them a very important life skill to survive in this world. Now, the social distancing. Now, everywhere, if you go out, you can't see the people are maintaining the social distancing. So it's our responsibility as a citizen to maintain this as far as possible. So avoiding close contact with anyone who is sick or has symptoms. Minimize their trip outside your house to meet friends. However, teens stay away from their friends during the COVID-19 pandemic is not always easy. They are naturally and appropriately seeking independence, which often causes disobedience. So they rely on and get influenced by their social network. Still, the emphasis is given on the social distancing in a timely manner. As everyone knows, the last 2 years were very challenging and everyone were at home. So there are a lot of cases of child abuse happened and a lot of mental health issues happened in the last 2 years. So keeping your child engaged is very important. So make sure your child to play outdoors with precautions, do some indoor activity to help your child stay healthy and focused. Also, encourage your child to keep in touch with friends through video chats, organizing gaming nights, and the most important is watch for any signs of stress or behavior changes. Now, coming towards the importance of vaccination in children. As everyone knows about it, but I would like to give emphasis on this. During this COVID time, there are many cases, many families who has not vaccinated their routine immunization due to fear of COVID. And because of this, they are more vulnerable to infections. The vaccine preventable diseases like polio, diphtheria, tetanus, pertussis, all these can be prevented with the giving timely vaccination. So these vaccines have prevented countless cases of disease and saved millions of lives. So all parents can vaccinate their children if they are missed any of the vaccination, and they can catch up as early as possible. As the school is starting now, make sure your children are up to date on their immunization, and because unvaccinated children are at increased risk for disease and spread diseases to others. The vaccination in adolescents. Now, once the 10 year is over, mostly the parental visits at clinic is stopped, as they consider that there is no more vaccination is left. But yes, the vaccination in adolescent is very, very important and on a priority basis to be done, because when adolescent gets sick, those around them can get sick also. Then the young and healthy people, they can also get sick. The vaccines are safe and effective. Effect of vaccine administered during infancy and early childhood can wane, and that is the reason booster dose is needed. Some vaccines given during adolescence help them to cope up with diseases during adulthood. So immunizing your adolescent school-going children is very important, because if the disease may happen, it may become very costly and it increases your doctor's visit and hospitalization. And also the sick children can cause parent to lose time from work. So it is very, very important to vaccinate as per the IAP immunization schedule 2021. Now, the important vaccines for adolescents are human papilloma virus and Tdap and TD vaccines. So these are the Tdap is the mandatory adolescent vaccines which has to be given. At the same time, cervical cancer, which is one of the common cancer in our country, and all girls should be protected through a very useful vaccine. Now, in this COVID time, all need to understand keeping routine is very, very important, as the children thrive on the routine. So timely sleep, timely food, then timely vaccination, all these contribute in their healthy health. And as you know, health is wealth. So you need to ensure that your children follow the routines. For that, you need to be very, very patient and being a good role model so that they can follow your lead. Now, COVID vaccine in children. Recently, it started the Covaxin, which is a whole virion inactivated coronavirus vaccine, which is given from the 15 to 18 years of age. So this vaccine is very important in terms of protection. So the total 2 doses are advisable 1 month apart. Now, there is one more vaccine which is in the pipeline, that is the Bharat Biotech nasal vaccine, that is a BBV 154. The vaccine is still not released, but yes, it is in the pipeline, and I'm sure with this vaccine, we can get a good immunity for the SARS-CoV-2 infection. Now, coming towards your child's nutrition. So providing your child with early nutrition help them a proper growth, health, and development. Poor nutrition can make your child ill and obese. So poor nutrition also make your child have an impairment in the growth and health. So healthy breakfast also improve the mood, memory, and understanding of your child and reduce absenteeism from the school. Asking your child to drink enough water would also improve cognitive function, which would help your child to be attentive in school. Now, these nutritional requirements are different as per the age. So every parent must know about the nutritional requirement as per the age so that they can plan their children's diet. At the same time, they should know about the developmental changes in their children as per the age. Now, not going in details, but here I would like to give 2 tips for during this COVID time. Many times the parents complain that our children don't eat healthy food, they like mostly junk food, and how to make them to eat more and more healthy food. So here I would suggest all parents that only giving healthy food will not make your child to eat them. So making cooking fun, cooking together, and a meaningful part of your family routine by involving them in a food preparation will play a major role to develop the interest. Also, the food has to be kept at an eye level so that whenever the kids are playing and if they see the food in front of them, there are more chances they can take it and eat on their own. Also, stocking up your grocery fridge with the healthy foods, there are more chances that they can eat more healthy food rather than eating junk food. And make sure you are not going to bring any junk food at home, so that it is automatically the children will not eat any kind of junk food. Once in a while you can give them, but it should not be followed in a routine. Now, giving 3 balanced meal a day and healthy snack in terms of fruits, also increase of fiber in the diet and decreasing use of salt is very, very important. The teenagers, as you have seen, the teenagers, their habit change as per the age. So you can involve them, you can take their opinions in the cooking, that will increase the more involvement. So make sure you teach your child to read the label of the any food product, so that they will be more aware about what they are eating, and this way they can be avoid unhealthy food. Also, decreasing use of butter and heavy gravies is important to avoid the obesity. And the protein-rich food, the more protein-rich food included in the diet is very, very important. So it is very, very important for a children to be having the healthy diet. The most important thing to making the kids away from the screen, because limiting screen time is very important, or they can watch in the advertisement and they demand to you for the unhealthy food. As this marketing company, they target the children in terms of their food, and as once the children know that this is what I want, they make their parents to give the same. As you know, Sri Hatta, Raj Hatta and Bal Hatta, it is very, very difficult to handle. So make sure you limit your screen time of your children, and not to show them frequently. Now, the teenager food habit, just now we have discussed, healthy eating in adolescence is essential due to body changes that occurs, but they become independent and make their own food decisions. They tend to eat more meals away from home, and they are mostly influenced by their peers. Meal convenience becomes a priority, and hence they go for soft drinks, fast food, and processed foods. Many boys and girls also go for diet to make weight for a particular sporting and social event. So let's the teen find out about nutrition through teen-oriented magazines or books with food articles, and by encouraging them and supporting their interest in health, cooking, and nutrition. Take their suggestions when possible regarding foods to prepare at home. Experiment with foods outside your own culture and have several nutritious snack foods readily available. If there are foods that you don't want your teens to eat, don't bring them home. So these are the mostly the nutritional tips what every parents can follow for their adolescents. So these are the food choices. So greens, vegetables, fruits, dairy product, protein, and oils. All this has to be included in your child for making them more healthy. At the same time, mindful eating is very, very important. So make sure every family have a ritual of family eating, so that the mindful eating can happen, and it's not only eating, it's a sharing of a day, which make your teenagers, which make your children more happy, and you can have a cut down from the screen. Everyone in the family cut down from the screen, so that you can spend more time with among each other, and it can be more happy and fruitful. Now, feeding in newborn babies. So breastfeeding is the most important component in the health of your baby. But if the mother is COVID positive, there are a lot of apprehension to feed a baby or not. So as per the WHO guidelines, the COVID positive mother can feed her baby with precautions. It is her choice to feed or not. But while feeding, she can wear a mask, and also she can clean her breast with water and before and after feeding. Washing hands thoroughly with soap before and after touching the baby. And if she feel unwell, she cannot breastfeed directly, so she can use cup and spoon to feed the baby with express breast milk. There is a lot of support needed for such women, and family support is very, very important. So all family members can support such mothers to get all the benefits of breastfeeding to the child. Now, this is a very important psychosocial effect what we have come through in the last 2 years. As Dr. Suryavanshi already explained, there are a lot of psychosocial effects happening in terms of schizophrenia, the anxiety, depression, and the suicidal tendencies. And the same is happening with the adolescents age group. There are a lot of suicidal cases are happening nowadays, which has to be taken care of. Our India is the, in adolescents population, the suicidal, we are in number 1 for the death of the adolescents. So it is very important for every parent need to understand what are the symptoms of a depressed child. Before that, they should know about the normal developmental changes in the adolescents, so that they can differentiate whether it's a normal adolescent changes or it is because of the psychosocial effect. So if you can see, if your child showing any irritability, anger, frustration on small issues, they want to cling to the mother all the times, or some kind of regressive behavior like thumb sucking, bedwetting, extensive gadget use on phone, tablet, TV, changing the dietary habits, if maybe they are eating too much or very less, or they are not sleeping, or they are awakening all the time, they become very quiet and shows no any interest or pleasure in the activities of meeting family and friends. Yes, these are all the red flags what every parent must know. And if you know about it, then the timely intervention can be done. So what can be done for such changes? So more and more you spend time interacting with them, it is very, very important. Listening them very patiently and avoid offering instant solution, display affection more readily, making a schedule for all family members so that everyone can spend time together. At the same time, involving children in daily course and appreciating their work. Connect them with family and friends, and do not only focus on the academics. Throughout the day, you can be in touch with your children and ask them about other things also. So this way you can help your children. But in some cases, if you find it's not happening, or it's you cannot make it treated, then that time you can always contact to the doctors, so that they can talk to your adolescent kids as well as the children. They can give the positive message, and also they can find out any symptoms and signs which are really need some medications or some treatment. They can help you. So take home message for this session is protecting your child by following COVID appropriate behavior, ensuring timely vaccination followed by proper nutrition so that their immunity is boosting up, considering their psychosocial health, finding out the red flag signs, also keep check on the red flag of the COVID infection for timely management. And last but not the least, being positive, happy, and having a grateful with everyone will help us to sail the boat through this COVID storm. I'm very, very thank you for all of you for patiently listening, and thank you very much for inviting me for the session. Thank you.
Yeah, thank you, Dr. Shruti, for your guidance on child and adolescent care, and covering most of the important aspects of it with respect to monitoring their health, the care what we need to give, vaccination schedule, nutrition, and psychological health as well. I should say the main reason why we invited and requested maybe Dr. Shruti as a guest, as a speaker for today, is because apart from the medical support, she is actively involved in social awareness and social programs as well. She has worked on several research studies and has been awarded executive board membership of Indian Academy of Pediatrics at Navi Mumbai. And that's the reason today's webinar is in association with the Indian Academy of Pediatrics, Navi Mumbai. She is also the director of child health at Rotary Club Smart City, Navi Mumbai, and involved in various community health programs, along with monitoring of the adverse effect of the immunization and initiative by the Government of India. So I think because of this vast knowledge and exposure, she has managed to give such a wonderful webinar today for all of us. And this area with respect to COVID was always ignored, though it was very much important. So we are very much thankful to you, Dr. Shruti. I should say that if any of the official is present from Indian Academy of Pediatrics here in the webinar, if at all, and if they want to share their views, they can come forward.
Actually, there are another webinar is also there right
Okay,
now.
okay.
So they are involved in that activity. It is very active academy. So all the time the webinars are going on. Yeah.
Yes, yes. Thanks a lot. So over here, participants, you can drop in your questions if at all you are having any query or anything much you want to know.
Yeah, it's not a query, just Dr. Shilpa's presentation and talk was very good. It was very appropriate for our forum. Then ACPI should take lead to every schools. We should recommend through our body. Nagappa Naik and we will work out and see that every schools and colleges, the consultants like Dr. Shilpa, they are their advice as advisor, and they should frequently visit and they should mentor the teachers, parents, as well as the children. So this is very much required during this period. So that is my whatever this we add on message. Thank you. Right.
Yes, sir. Thank you very
Congratulations to Dr. Shilpa. Yeah.
Thank you.
Yeah.
Excellent talk. Yeah.
Dr. Shruti, my name is Dr. Shruti. And
Shruti, sorry,
yeah,
Dr.
yeah,
Shruti.
it's okay. It's
So
okay.
I'll be in touch with you. Because this whatever you are, I want to write up because I am the editor of Indian Journal of Hospital Pharmacy, Indian Hospital Pharmacy Association.
Yes.
So it is a 60-year-old journal. So we will publish one short write up if you give. So
Yes,
we will
sir.
publish this and I will contact you. I will require a pediatrician's note for our Indian Journal of Hospital Pharmacy. Okay. Thank you.
Definitely, sure.
All the best.
And to know you that we Indian Academy of Pediatrics, also the Adolescent Health Association, we have done a lot of school health programs. Last year also we have done a very wonderful, since last 2 years we are conducting, because this is recently formed body. We are conducting the school health program, which focused on the mental health, at the same time the overall care of these teenagers. So definitely we will take forward your request, and we will arrange more and more school health programs.
Because in our hospital we have a pediatric pharmacy, geriatric pharmacy specialization is also there in USA and all. Even in India, we are that subject is being as a specialization.
Yeah.
Okay.
Sure, sir.
Yes, Dr. Shruti, as a part of questions, I'll see for below 12, below 18 now, we have started giving vaccination. So over here now 15 to 18 we are covering, but the students who are below 15, okay, there is a miss nowadays what people are following, that they are taking influenza vaccine additionally. So will it help out, you think, taking additional influenza vaccine for that age group?
Yeah. So see, influenza vaccine, I just wanted to let you know that it is given as a regularly, as a routine practice from the age of 6 months. Okay, and it's from 6 months to 18 years. So it's anyways, it is very important, because you have seen there are a lot of reduction in the influenza cases from 2010 to 2021, and the vaccine coverage we have done in the last 11 years, it is helping out. So definitely influenza routinely has to be taken. It's not related because influenza is taken, so there is no necessity of COVID. It is not like that. Influenza vaccine will protect for influenza virus. At the same time, COVID vaccination is important. But right now, the guidelines is available for only 15 to 18 years, because this is the age group which is very vulnerable to the COVID infection. Below 15 years, definitely the vaccine will be available in a shorter period, step by step. So influenza vaccine routinely it is recommended, and that can be done with your pediatrician as a one-to-one discussion.
There is fear about vaccines as well, though it is available from 15 to 18. Many are very comprehensive, whether to go for the vaccine, especially with some of the blood clot cases. So what will be your advice on the same?
Yeah. So see, basically, usually the fear are associated with the incomplete knowledge. So yes, there are few cases might be they are saying like it is because of the blood clotting and all. But this vaccine, when it is approved for the community, it goes through a lot of trials. So a lot of studies are done, and after that only this is given to the society and the community. So the vaccine what we are giving right now by the government of India, it is a DCGI approved. So in that case, the vaccination is very, very important, because if this age group, if they get COVID infection, they may have this kind of comorbidities like clotting and all. So what we can say, there are very few cases. So common things happen commonly. So there are not that much of cases which is having this issue. So parents need to trust on this part that common things are happening commonly. So we should definitely go with the vaccination to protect our children rather than worrying about few cases which are happening once in a while.
Okay. And it is about like, using mask in the kids, like, as you said, you have told during your presentation also, like, in which cases and which are the masks which are required to be used. So many times what I have seen frequently nowadays, the kids go out, come and the same mask they use again and again, like, so how safe it is?
Yes, so this is very important and useful question. What everyone must know about this, that using mask for protection is very important. As I explained you, that the kids, they need to understand how to use the mask. So the proper technique has to be taught to the children. At the same time, the mask, if they are using the cloth mask, that has to be washed daily. The same mask can't be used day by 2-3 days. Otherwise, that is the one of the source of infection. The way we are washing our hands, it is very important to wash the cloth mask also. And if they are using the disposable mask, then definitely you are going to dispose the mask after one use. It depends on that how long they are wearing the mask.
Yeah, okay, yeah. Thank you, Dr. Shruti. Now there are no more questions in the chat box, but comments are there. Thank you, ma'am, for a very nice and informative session. Then thank you for your session, madam. Very nice session, informative session. And yes, all of us were very much thankful to you, Dr. Shruti, for such a wonderful session, especially for us.
Yeah, thank you very much.
Yeah, now coming towards the end of the webinar and to conclude the webinar formally, I request here Professor Aditya Ghuge, Secretary of WRC-ACPI and Faculty of D.Y. Patil School of Pharmacy, Navi Mumbai, to propose the vote of thanks.
Yeah, thank you, Dr. Shilpa, and thank you, Dr. Shruti. So on behalf of WRC-ACPI, I would like to propose vote of thanks. So first of all, I would like to thank Indian Academy of Pediatrics for collaborating this event with us. That is the adjusting to the new normal. For the first session, Dr. Anand Suryavanshi, who is the director of Phoenix Multi-Speciality Hospital, Nanded, who gave an overview about COVID-19. Thank you so much, sir, for being present and involving everyone into the session and briefing us about the new normal. Secondly, I would like to thank Dr. Shruti Kalkekar, who is the director of Dr. Kalkekar's Cura Clinic, Seawoods, Navi Mumbai, for giving an overview about child and adolescent care in COVID times. So thank you, ma'am. Thank you for briefing us about what care should be taken on child and adolescents in this COVID times. Thank you so much. Next, I would like to thank our partner institutes, Dr. Rajaram and Tarabai Bandekar College of Pharmacy, Goa, and today's our host, Dr. Shilpa Bhilegaonkar, ma'am. Thank you so much for collaborating and coordinating this event with us. And she has taken a very way forward with us. Thank you, ma'am. And obviously a proactive member of this, our WRC-ACPI as a Goa State Coordinator. Next, I would like to thank Dr. Rakesh Somani, sir, who is the president of WRC-ACPI, for guiding us into this collaboration and this event. Next, I would like to thank also Dr. N. Udupa, who is present with us and working with us since last 1.5 hours, who is the vice president of ACPI national level. And last but not the least, all the audience who is present over here today. Thank you very much. Thank you very much for patiently listening to our webinar. So now I would like to conclude the session, and thank you everyone for being present here. Yeah, Dr. Shilpa, would you like?
Sir. Thank you, everyone, and I hope your participation will remain with us in all our future endeavors. And that's all about today's webinar. Aditya, sir, I think we can
close the session now. So I'll just close the session. Thank you, everyone.
Yeah, thank you.